Now we have the answer to your foot problems, how you can get your bunions corrected by a local expert. We share the details next.
As we age, our feet may be feeling the pain and bunions become more of a concern. But what is a bunion, and are there ways to treat bunions without surgery? We have an expert here, TSAOG Orthopedics' newest podiatrist, Dr. Cory Moczygemba. Welcome.
Thank you. Thanks for having me.
So happy to have you. Let's talk about what is a bunion. Let's start with that.
Yeah, so a bunion is when a bump forms on the side of your foot. It generally happens because we get a shift in those bones in the front of the foot, and it can cause the big toe to go towards the second toe.
Okay.
And if it becomes big enough, it can become painful, and it can lead to other problems like pain in the rest of the front of your foot or even hammer toes or something like that.
So are there conservative or non-surgical options to help if somebody does have a bunion and it's starting to get painful?
Yeah, no, absolutely. So generally with the non-surgical options or conservative options, we're trying to accommodate or relieve pressure to that bump. That's generally done through wider shoes. So if you go to a shoe store, you may see double E or wide shoes. Those tend to be wider in the front of the foot. We can also use a spacer in between the first and second toes, and that'll help shift that malalignment out of the way. The only problem with that is it only works while you're using it. You may see on social media these things that promise that they're gonna brace and train your toe to be straight. Unfortunately, to my knowledge and with my patients, those don't work. They only work while you're using them. So for something more definitive, we usually have to talk about surgical correction.
Got it. Okay, you can't train your toe, y'all.
No.
Okay. Okay, what is involved in the surgery and who is a candidate for MIS?
Yeah, so most people think with bunion surgery that we're just shaving off that bump or that painful area. But if we were just to do that, then your bunion would most likely come back. So what we're actually trying to do is fix that shift there and correct that bone. And that does usually require putting in some plates or screws or a combination of both. And there's a few ways to help out with the bunion. And so it's important that you come in so that we can take a look at you, look at x-rays, and see what's the best plan for you.
What's the feedback from people?
Oh, it's great because, you know, with traditional surgery, we're having to make a bigger incision. I mean, we get to the same goal, we're able to fix that bunion, but when we do that, you have more swelling and more soft tissue disruption afterwards. And then with minimally invasive style, we're able to use a series of smaller incisions to still get that same goal.
Got it.
And so with that, you know, there's less, you know, swelling and pain afterwards, and we can have a quicker recovery.
That sounds great. Okay, how does one get a bunion, if you don't mind me asking? Like, how are they?
Unfortunately, you can probably thank mom and dad for that. It tends to be a genetic thing.
Really?
Yeah, some shoes can make you feel it more or maybe accentuate it a bit more, but usually it's for mom or dad.
So recovery, you mentioned, especially with the minimal invasive surgery, it's not that bad, right? The recovery?
It's much, much better, which is honestly the most exciting part to me. You know, with foot and ankle surgery, we're usually asking you to stay off of it, you know, for a while. And that can be hard for patients, and it can kind of take away their independence. And so with minimally invasive surgery, we're asking you to stay off of it for a few days. That's usually using your heel to stay off the procedure site, or even using like a walker or crutches for a few days. But then after that, if everything looks good, we're getting you into a walking boot, and we're letting you put pressure on it in a protected manner. So you are having to do that for about 4 to 6 weeks, but if everything looks good, then we're getting you back into regular shoes.
There you go. It's worth it, y'all. Thank you so much for all this information. Now, if you'd like to book your appointment with TSAOG Orthopedics podiatrist Dr. Cory, you can give him a call, 210-804-5400. You can also visit the website, tsaog.com.